Good morning. Today I'm going to talk about the United Conservative Party, their policies, and how they impact vulnerable groups. That being said, I'm going to focus on three specific issues, knowing that there is so much more, and I will probably have to do a part two and part three and part four and on, because there really is nobody left to harm in Alberta. Specifically, I'm going to focus on Danielle Smith uh, when she took the UCP party and what has happened since then. And I'm going to give a little history of the UCP because I think we need to know that, especially for people watching this who are in Alberta and don't know that. The UCP was originally it was two separate parties. It was the Wild Rose and it was the Progressive Conservatives, and they combined to make the UCP in 2017. That was under the leadership of Jason Kenney, and any Albertan will remember just how awful it was under Kenney. It is so much worse under Danielle Smith. Today, the issues that I'm going to focus on are the LGBTQ plus community, specifically trans youth, the effects on disabled youth and adults in Alberta, and the effects on the healthcare system. And if you're not aware, Canada, all Canadian provinces have a public healthcare system. It is being systematically destroyed here in Alberta. Like I said, there are so many other issues, and there will be several parts. It's complex. Her attacks on vulnerable populations in Alberta have been criticized by human rights organizations, by educators, by healthcare professionals, social justice advocates. It doesn't seem to have helped. The more we fight, the more she lies. Now, we're going to look at how this focus on austerity and I guess populism has affected, as I said, these three issues, but there's so much more. So, as I said, the UCP was a combination of the Wild Rose and the PCP in 2017. Smith's philosophy is rooted in the idea that government intervention is bad, and that this is particularly true in areas such as healthcare and education, supports for persons who may be vulnerable, like persons who are disabled. She talks about this as freedom, as personal rights. She just doesn't look at the implications. Jason Kenney, who was the first leader of the UCP, had a more calculated approach. He was more focused in the ways that he cut in. Smith has brought in the style that she had as both as the leader of the Wild Rose and as a online commentator, a radio commentator, and it's very angry and it's very confrontational. She talks about things like freedom, personal choice, parental rights, just ignoring all the rights of the community she's impacting. During COVID, she criticized vaccine mandates, the mandate to wear masks, etc., calling it an infringement of rights. And again, we know this not to be true. There's more than enough research showing that things like vaccinations and wearing masks help. She was just ignoring the research in deference to personal rights. So as I said, I'm gonna focus on these three issues more currently. First of all, we're gonna look at the LGBTQ plus communities, specifically trans youth. I think a lot of people in a lot of places are aware of what she's done. Children under 16 now require parental notification by the school before they can change their pronouns or their names. She frames this as a measure to empower parents, but in fact, LGBTQ plus communities, individuals have widely criticized this move as a form of institutional outing. And research shows what this can do to youth who feel unsafe revealing their gender identity at home. It forces them to obtain parental permission, which strips them of their basic rights, their autonomy, and puts them at risk of both emotional and physical assault, both by their parents and both by the community around them. Mental health professionals have discussed the damage this is doing, have researched the damage that can happen in this way. All of that is being ignored. Smith talks about this as parental rights and ignores the lived reality that all LGBTQ plus members of the community, particularly youth, particularly trans youth, have to live in the hostile environments that they have to deal with often that are so degrading, abusive. She's simply ignoring the truth. Teachers are forced to either inform parents or face punitive measures if they try to support their students. She's also placed restrictions on gender-affirming care. And in early 2024, she placed these new restrictions on puberty blockers and hormone replacement therapy. These treatments, which are considered best practice by the World Professional Association for Transgender Health, are already subjected to rigorous mental health and medical evaluation. So there was no reason for this. These policies simply introduce additional barriers. They require multiple doctor sign-offs. They implement an arbitrary age threshold. The fact is, the erosion of healthcare for LGBTQ plus individuals targets trans youth particularly. It seems to be a direct attack on the medical consensus, and it seems to be a politicization of healthcare for trans youth. She's also threatened to use the notwithstanding clause from the Charter of Rights. And what that means is that it would suspend judicial review and override constitutional protections, which is a tactic that just isn't used in Canada. It has rarely been used. The implication of this in Canada, it's mind-boggling. We don't do this. But it speaks to how the UCP governs, law notwithstanding. And then we go on to the second group or issue I want to discuss, which is persons with disabilities. So of course, I think people know there have been budget cuts to disability services. What they don't know is that there has been a steady defunding of services under the UCP for persons with disabilities. And I'll get to healthcare in a minute, but the combination of defunding in both areas has left persons with disabilities quite vulnerable, unsafe. For example, the Provincial Assured Income for the Severely Handicapped, or AISH program, was de-indexed from inflation in 2019 and recently saw a partial reinstatement, which is far below the inflation rate. It has to be under 2%. She has focused on or prioritized efficiency in market-based solutions for pushing for greater involvement for private contractors to be involved in disability care. But individuals and families report inconsistent care, long wait times, inconsistent access to these programs and a reduced quality of care. And I can personally speak to that. I was in my home for over a month, despite the fact that we had made the referral to the Canadian National Institute for the Blind, which I have been a member of for over 30 years before that, because they've changed the structuring. So I had no access to the outside world. I didn't know how to get to the grocery store. I managed with great difficulty to access the laundry room. I had to get help with getting my mail after 2 weeks of not being able to access it, and it was only because I have a very nice site manager. And the list goes on. Basic needs were being ignored because apparently, as a low-income person with disabilities, I just don't matter. You try cooking when you can't see your stove and you don't have, it's so simple. It's dots on it that would help me find where I'm going, I don't have those. So really basic, essential needs were being ignored because of defunding. She's also engaged in a identity politics around disability. So she has conflated neurodivergency and disability with identity politics, talking about these as ideological talking points versus personal experience and identity. And so for instance, specialized supports for neurodivergent students have been cut with the expectations that teachers will absorb these supports. The approach to disability is that we don't exist. What it does is it increases stigmatization. It further marginalizes both youth and adults with disabilities. And it reflects a broader cultural trend in Smith's governance, which is that reducing systemic barriers to personal responsibility and individual choice, even if it means abandoning the most vulnerable, is the way to go, at least according to the UCP. And then there is healthcare, and this is one that affects almost every Albertan. Only the very, very wealthy can afford private healthcare, and they can no longer cross the border as easily as they could just a few weeks ago. With Trump coming in, they are going to experience healthcare the way the rest of us do. It has been a major target, a primary target of the UCP. Alberta Health Services has undergone repeated reforms and decentralization. There's been increased privatization of surgical and diagnostic services. Let me tell you, it doesn't work. Smith argues these moves are necessary to reduce wait times and provide choice. However, in fact, wait times have dramatically increased. It's creating a two-tiered system where those who can pay receive faster, better care, and the rest of us are screwed. It places undue strain on public hospitals. It undermines the universality, which is a key component of Canadian healthcare. The impact is especially severe for persons with disabilities and low-income Albertans. And there are a lot of Albertans who are simply being thrown aside. It has also significantly impacted outlying communities. So smaller communities, which a high percentage of Albertans live in, are at this time receiving no hospital care or very limited access. And so let's look at some examples, like COVID-19 and public health erosion was huge. She gained notoriety for promoting these alternative treatments. Any American has heard this joke, and opposing vaccine mandates. She defunded COVID-19 testing infrastructure, discouraged masking in schools, and minimized public health guidance. This undermines trust in health institutions, public health institutions, and it places immunocompromised and disabled Albertans at greater risk. what this has led to is like rising emergency room times, overburdened hospital staff, worsening health income outcomes for marginalized groups, such as immunocompromised individuals, persons with disabilities, older people, children. Am I making my point? The legal implications, the implications for civil liberties of her policies are huge. So the way that they're enforcing anti-LGBTQ plus policies is unprecedented. This has never happened in Alberta before. The idea that they would be willing to sidestep court challenges by using that clause and silence opposition from affected communities is mind-boggling. It is not Canadian. It is not Alberta. They have also passed laws to expand executive authority to bypass public consultation on environmental and healthcare matters. So this reduces democratic accountability and it concentrates power in the Premier's office. Civil rights organizations are trying to fight back, but it is very difficult. As our civil liberties erode, as our ability to fight back is being eroded, we have less and less opportunity for the Alberta we once knew, which was a place where human rights were beloved, where they were respected. That's gone. Now, there has been public protest. Student walkouts, teacher strikes, public demonstrations, they have erupted in major cities. They are organized by LGBTQ plus communities and groups, healthcare unions, disability advocacy groups. Legal challenges are underway. For example, against the pronoun policy. And international human rights watchdogs have condemned Alberta's approach to trans rights. Teachers' associations have spoken out against the politicization of education. While medical professionals have urged the province to reverse cuts and to restore access to gender-affirming care. However, the government has attempted to discredit these groups. Despite that, public resistance has only grown louder, especially among our youth. Go kids. There are broader socioeconomic effects. We are seeing mental health services being very much overwhelmed. And this is particularly among queer youth who are being harmed so significantly by these policies. Disability support networks are shrinking, leaving more and more persons with disabilities without basic essential services, like access to orientation and mobility services for someone who is visually impaired. The Alberta used to have a reputation, even though it tended to go with economic austerity, we had a reputation as a place that respected human rights, civil liberties. That is gone. Social trust is declining, especially among vulnerable communities who feel targeted. And the populist rhetoric by Smith has it's energized her base, but it has alienated many Albertans. And her base, folks, it's only a matter of time. She's going to, like I said, there's so many other groups and vulnerable groups that she has targeted. You will be targeted. It's just a matter of time. This is a leadership that places ideology over evidence, that places rhetoric over truth. And while the idea of parental rights and personal freedom resonates with parts of the electorate, others are recognizing it for what it is. It has disproportionately harmed vulnerable Albertans. This is a systemic thing. This is not accidental. She knows what she's doing. She's silencing dissent through legal tools like the notwithstanding clause so that she can continue to tear apart our province. We must continue to fight back. I say this sincerely. I grew up in a time where people fought back. We had to. We saw human rights being trampled on and we fought back. And I'm proud to say that Alberta's youth is fighting back, but I say we need to fight back on every level. We need to get out there. We need to make our voices heard. If you enjoyed this video, please hit subscribe and like. I know it's not important to you. It's really important to me. Please share with those who might be interested. I love feedback. I love interaction. Keep it respectful, but let's chat about this. Like I said, there are many more issues. I will be delving into them. It's a lot. If you haven't been hit yet, it really is just a matter of time. And with that, I remind you, to be senior is to be proud. Hugs.